Oops. Good afternoon, everyone. Today is Tuesday, April 13th, 2021. The time is 3:02 p.m. This is a special meeting agenda. We have two interviews scheduled for a board-level position on the Panhandle Health District, and we are District 1. And I am officially calling this meeting to order. Attending are Commissioners Duncan, Brooks, and Filios. Do we have any changes to the agenda? Hearing none. Okay, so our first candidate is Mr. Michael Andrew Burns. And what I should point out, Mike, do you go by Mike or do you prefer Michael?
Mike is fine.
Mike is fine, okay. And Laura Whalen, who's our Panhandle Health Director, wanted me to remind all the candidates that typically it's about 9 to 10 meetings a year, and they typically run about an hour, hour and a half, usually during the lunch hour. Not necessarily, but typically. Okay then, so why don't we do the following? We're going to ask a series of questions, and certainly at the end you can ask us questions.
Okay.
But before we start, we've got your resume. It's very extensive, and we appreciate it. Is there anything before we start that you would like to say to us, or just to give us a brief background, if you wish? Your background appears to be primarily in nursing?
Yes, that's correct. So I currently am employed by the VA, the Veterans Administration, as a clinical reviewer. And I've got coming up on 30 years of experience as an RN.
Okay. I noticed your education, do you have a 2 or is it a 4-year degree?
Got an associate degree.
You have an associate degree, okay. All right. Anything else you wish to share? Would you like us to just start asking questions?
Go ahead.
Go ahead, okay. That might help key you in. Leslie, you want to lead us off?
Sure. What is the role of the Panhandle Health District's board?
I actually checked your website because I was looking for that. So I'm not exactly sure, except that I believe it's an advisory board for the county and the county commissioners to make decisions regarding the delivery of health care to the citizens of the Idaho Panhandle.
Okay. Do you have any idea, for example, where their funding comes from?
Specifically, no. I would suspect that most of it comes from the state and the county, and there's probably even some federal money involved as well.
Okay. Bill, did you want to take a question?
Yeah, I get right to the meat of it. How do you feel about you've probably been following what's been going on?
About what?
You've been following the Panhandle, what's going on at the Panhandle?
Oh, somewhat.
Okay. What is your feeling about?
You mean the mask mandate in
Get
particular?
into it.
Oh, sorry.
About a board like that mandating that people wear masks?
Well, I guess there's a couple different issues there. Mandates versus laws. And then, I think more importantly, though, is the science or the data behind it. And I just don't, I think that the science to support the use of masks is quite sketchy. For example, take North and South Dakota. A lot of business restrictions and mask mandates in North Dakota. South Dakota, to my knowledge, they don't have either. And the curve's it's almost identical.
So if you felt the scientific data warranted it, would you be in favor of a mandate?
Well, I think it would be at least then more advisable or something to consider.
Well, in a position like this, you get to vote on that.
Okay. So the question again is, if the science supported it?
If you in your mind felt the science warranted, made it look like a mask would be a good idea, would you mandate that? Would you vote to mandate that?
Specifically, that would be helpful, but I don't think I would necessarily vote to mandate it, given the fact that the vast majority of individuals who are susceptible to the coronavirus are or very elderly people or people who are severely immunocompromised.
Oh, you're done?
Yeah.
Oh, okay, back to Leslie, okay.
What do you think about the one septic system per 5-acre minimum over the aquifer rule?
Leslie, I'm not totally familiar with that. What exactly does that require, one septic system per 5 acres?
Okay, so you know that we have a sole source aquifer here in Kootenai County?
Yes.
Yes. So any development over the aquifer is limited to one septic tank per 5 acres. So only one, essentially kind of one home over that. Now, if it's hooked up to sewer and it's over the aquifer, then the rule does not apply. But it's limiting septic systems per 5 acres over the aquifer. And it's a rule that Panhandle Health has.
Well, that could be a health-related question. I believe that's more environmental, and I just don't honestly know that there's good justification for that.
Okay.
Okay. Do you believe that nutrition or prevention should fill a bigger role in Panhandle Health's community education?
Absolutely. I have to be honest with you. I don't know how much it does right now, but I believe in modern medicine in particular, stress needs to be put on preventive medicine. It just prevents a lot of problems. You're talking to a guy who actually sprouts seeds in his kitchen pantry. So it's something that I believe in personally. And no, I'm not a vegetarian. I love grass-fed meat too. But no, prevention is crucial. And it also helps to save money.
Okay. And how's that?
Well,
Oh, you mean by, go ahead.
people who take responsibility and accountability for their health don't get sick nearly as often. I used to run a clinic, and this was back in the days when all the health food, the fast food places, every time you pulled up, they said, "Hey, do you want to supersize that?" And so we had people come in with their great big meals like that and drinks that big, sugar-loaded drinks. And of course, the doctors would be like, "Here, take this for your cholesterol, take this for your diabetes." There were some good doctors that really tried to hold these patients accountable, but the fact is it takes a lot of self-discipline. But yes, to answer your question, I believe preventive medicine is it's very critical and important.
Okay. Okay, thank you. Bill?
Can you name some other areas that Panhandle Health is involved in the county?
Well, I mean, like I said, I don't follow it too closely. I did check your website. I know there's a lot of services, and of course, as I said, I've been an RN for 30 years, so I do kind of have an idea. But I know there's, there were said I think child nurse services, substance abuse. And things of that nature. It looks like there's dozens of different services that you all provide.
Okay.
Suicide prevention was another, and that's something that's actually very close to me because I work closely with veterans.
And you're a veteran yourself.
I was actually in the Army Reserve, so technically I'm not considered a veteran.
Oh, well, we consider you a veteran.
Thank you.
Okay. Leslie?
Can you imagine a circumstance when mandating a vaccine could be necessary?
I don't really believe so. I mean, I just don't know if that's the proper role of government. I have doubts that the government has that ability to compel somebody to take a vaccine. So there's a health-related question, and then there's a question about personal liberty, and I think both need to be considered.
Okay. I guess the question that's an interesting question. Okay, so well, obviously you went through basic training, as did Bill, as did I. That was quite some time ago, and but let me tell you, they didn't ask us whether or not we wanted to be vaccinated. We were. Would you put the military in a different category than civilians when it comes to mandating vaccines? I don't know do they still mandate them in the military?
I know that they give them,
I'm sorry. My son's in the National Guard. They still mandate. Okay.
they don't even ask, right?
They don't ask. Okay.
They do ask you though if you have been recently vaccinated.
Oh,
They'll
okay.
look at certain things when you go up to basic training, and then if you have had recent vaccinations, then
Then they don't.
Okay.
Okay,
Yeah.
great. Thank you for that. Okay, so it's interesting, you mentioned the proper role of government, and I'm going to go there because it just seems to be such a hot topic, not just locally, but nationally. When we talk Panhandle Health, we're talking, well, primarily health. Should the government even be involved with that? In other words, if you have a personal liberty situation, right, and you say, look, if people should be allowed to make their own decision regarding their health care, should the government even be involved in that arena?
Well, what do we have? We have the government exists to protect the life, liberty, and property of individuals. So the short answer would be yes, the government has some sort of role. Specifically, can it compel individuals to take a vaccine? Well, when I joined the armed services, I volunteered to do that. I was working for the federal government. I don't think that same thing applies to private individuals.
Okay.
And we do have to also be careful because sometimes politicians have ulterior motives. I can't assume that every elected official, whether they're at the federal or the state level, is necessarily looking after my best interests.
Okay. Bill?
What areas do you see stem cell therapy being useful for?
Stem cell therapy is useful in a lot of areas. I mean, I guess one area that comes to mind would be spinal cord injuries.
I mean, things that are proven, peer-reviewed type of research that shows that they're useful.
To be honest with you, Bill, I have read about that somewhat, not recently, so I can't mention a peer-reviewed study that would, specific to your question.
Thank you.
Leslie?
How will you keep the Board of Commissioners apprised of the issues facing Panhandle Health?
Well, I'm sure there's a committee that does that, isn't there?
Well, you're on if you're selected to be on the Panhandle Health Board, how do you keep us apprised of what you're voting on, what's coming before the board?
I don't know the exact process, how that's done. Leslie, I don't know.
Sorry, it's probably just kind of an unfair question. Email, meeting with us quarterly, how would you see that your role to keep us informed? Because you're our direct representative on there.
Well, I imagine there are quarterly meetings. Obviously, email's probably important now too, right, with the so-called pandemic.
I noticed that you had a few, going into your background, you had a few stays in are you from Kansas originally?
Originally, no, but I lived in Kansas for about 14 years.
Okay.
Yeah.
And was that time spent in the reserves? Is that where you?
No, it was not.
Okay. I noticed that in your nursing, you've actually covered quite a wide territory. So, for example, I see where you served as a psychiatric nurse. What kind of nursing? Tell us a little bit about your exposure. What I'm looking for a certain term. Like when residents go through different exposures to decide what they want to specialize in. I don't know what the right term is, but go ahead.
Yeah, nursing doesn't quite work exactly that way, but
Right.
as you see, I have a very well-rounded resume. I've worked in a lot of different
Right.
fields. I've worked in management. I ran a clinic. I've worked in long-term care. I've worked with veterans. I've worked with veterans have mental illness and mental health problems. And so, yeah, I've got a fairly well-rounded resume there, and I've worked in a lot of different areas. And honestly, I really love working with the veterans too.
What specifically draws you to that or to them?
There seems to be a real camaraderie with the veterans and just a kind of a fellowship and being a guy. I really enjoyed that. And again, I worked with veterans who had mental health issues, and it was really rewarding to help people who were in crises. And most of them were when they were admitted, because I worked in acute mental health.
When you deal in that arena, mental health in particular, and specifically with veterans, does some of this or does much of it relate back to their duties, their military service?
It really does. Obviously there's a lot of dynamics involved, but a lot of veterans, particularly the combat veterans, a lot of them struggle with some severe issues, anxiety, depression, post-traumatic stress disorder. It's tough on a lot of them.
So then, was most of your experience in the mental health field?
No, that was kind of a detour for me,
Okay.
but I have worked for the VA for 14 years, but yeah, so. No, I spent a few years doing critical care review in critical care units in hospitals in the Sacramento area. So that was another aspect of my career that I really enjoyed.
Okay. Bill?
Don't have any more.
Leslie?
I think just one more. Do you feel like you have time to devote to learning all of the issues that Panhandle Health deals with?
Yeah, I do have the time. Like most people, I'm a fairly busy guy, but yeah, I would make time, and I do have time. I live fairly close to town, and I'm a dedicated citizen. That's why I'm here, because I want to do this. I want to help my community. I want to give back. And as I said when I started, I think one of the important things too is that decisions be made on science, logic, sound reasoning, and data. And so that's the most important thing to me. I don't like to get too political.
Okay. Do you have any questions of us? What would you like to ask us?
Well-
Individually, collectively, however you
Yeah,
wish?
you hit me with a few hard ones, so let me return a couple.
yeah, go right
so,
ahead.
like your question about communication. Why don't you fill me in a little bit more about how that is done? Because I'm sure I'm sure there's some sort of relationship between the board and you commissioners that, I'd just like to know a little more about the process.
Sure. Well, Panhandle Health Board is not our typical advisory board, but the way our advisory boards work is when they have a meeting and they have a recommendation to come to the commissioners, then they will schedule a meeting with us. Sometimes a director will just give an email update about what went on in the advisory board meeting if there is no further action by the commissioners. So for instance, if there was another mandate proposed, it will come before the commissioners. So we would expect that our representatives on the board would be speaking to us, email, meetings, however, to let us know, okay, this is coming forward, this is going to be something that you're going to have to deal with.
Phone calls are nice.
Yep,
Okay.
yep. So,
Keep going.
Can you tell me a little bit more, because I actually did attempt to attend some of the meetings. Can you fill me in a little more about public access to the Panhandle Health Board meetings? It seems to me, from what I heard and witnessed, that it was restricted in some respects.
I'm the liaison, and it was, people by Zoom could pretty much be there without exception. Problem was the room is relatively small, and the people that wanted to come in were a large number. And so that didn't work very well, but people didn't want to accept that. So there was a lot of protesting and sign waving outside.
So
because
it
they
had to
felt-
do more with the capacity.
Oh, it does. I mean, if
Okay.
you look at it on Zoom, you can see the room's about not much bigger than from the doors there to this area. And how many people can you safely fit in there during the height of, COVID? Just the fact.
In fact, the first meeting they held, where they announced the mask mandate, which was at the end of June, was held here because they expected a larger crowd.
And they had one.
And they had one. That's true.
If
Keep
I
going.
could ask one more,
Sure.
too.
No, go right ahead.
And I'm not trying to get too controversial here, but I'd like to also
Sure.
kind of figure out where you all are coming from. Do you all, I mean, do you think potentially there are or could be conflicts between the politicians and the people's or the people's rights? I'll just throw out as an example, there's been a lot of, to me, I'm very concerned about censorship, especially when it comes to scientists and doctors. Some of them with very, very stellar careers and impeccable credentials. So I'd like to know, one, it seems like they really, really demonize the drug hydroxychloroquine. There's another one that's in use now called ivermectin, which has shown to be extremely effective against coronaviruses. And so that's my question to you. Could some politicians have ulterior motives or maybe not be looking after our best interests? For example, the CDC, I think according to Robert F. Kennedy Jr., he said that they sell $4.5 billion in vaccines per year. That to me, that's kind of troubling because it's a conflict of interest, especially when you talk about possible forced vaccinations. I mean, that's a financial conflict of interest.
The second medication you mentioned, what was that?
It's ivermectin.
Okay.
It's actually,
And you
that's,
said this is effective against
COVID.
COVID.
COVID specifically, but also some other viruses as
Okay.
well.
Because there's a whole family, other than the coronavirus.
Yeah,
that we know and
this
love.
one specific doctor claims that it's not only effective against COVID-19, but any variants because of the molecular structure of it. And it's extremely safe. They say out of 4 billion doses that have been administered worldwide, that there's only been 2 deaths, and those are people that had pre-existing conditions. So it's an extremely safe drug.
What's it called again?
Ivermectin. Interestingly, it's in the class of drugs called antihelminths, which are traditionally used as antiparasitics.
is it a malaria treatment? Or
That's the hydroxychloroquine.
Oh, okay.
That's hydro.
This one's a worming medication or
Oh, a dewormer,
antiparasitic.
okay.
Yeah.
Gotcha.
So it's got
So you're thinking there may be some political motivation in not advancing this further as a potential cure for COVID? Is that what is that your concern?
I believe there are other treatments available. Ivermectin is one of them that's been shown to be extremely effective. But yes, I do believe there are other things that a lot of doctors would be willing to use, but haven't been allowed to. I know there's that one Democratic doctor, Dr. Simone Gold. She was in hot water for she's an emergency room physician, and she got in trouble for prescribing hydroxychloroquine from the emergency department. It's like, what happened to freedom of medicine? Again, this is impeding the professional lives of doctors and scientists. I don't think that's right or fair.
Well, I can't speak to that part of it, you know, who's preventing what or doing what, but what I can say is every human is individual. And when you talk about the government trying to protect our health, well, I have a problem with that because, like you mentioned, the supersizing, is it the government's role to come in and say, you cannot supersize your fries? So I don't believe that is the role. So then there's that delicate balancing act of where is that line drawn? And I think in this healthcare situation that it's very important that we realize there are different treatments that work for different people. I know in my own family, this one will take this medicine and works great. This one takes this medicine, doesn't help at all. So I think it's one of those very individual things, and I think that's what we depend on our doctors for, is to look at us individually and be able to say, you know what, we're going to try this, or we're going to try that if that doesn't work. And so I think to that effect, I don't want any censure of any doctor being able to look and read their patient and figure out what the best course of treatment is.
I agree 100%. I don't want them telling me what size drink I should be drinking, and I don't want them coming between me and my doctor to tell us what kind of healthcare decisions we make between the two of us.
Okay, so what you're saying is that frequently that's what occurs.
I do
Or
believe
does occur.
I believe that has occurred a lot. There's another drug, hydroxychloroquine, that's been used worldwide for decades and
largely for
decades
malaria.
without a prescription, and as far as I know, it's a safe drug.
Well, thank you.
Thank you all.
Putting your
Appreciate
hat in
your
the
time.
ring.
Yeah, likewise. Thank you. And we've got a number of interviews to conduct. I think we've got 6 that we're scheduling. And I imagine we'll get through them this week. So some notification and selection, I suspect, would occur next week.
All right,
If not
very
by
good.
the end of this
Well,
week.
thank you again. Appreciate the time.
Likewise, Mike,
All
thank
right.
you for your interest.
Dr. Jameson?
How are you?
Thank you, sir. How are you?
Fine. So this is Bill Brooks to my right. I'm Chris Filios. Welcome. Good to see you. We're still on? Okay, so this is our second interview. And I think you probably heard what I just said, that we've got, well, we started with 17 or 18 candidates. You're one of 6 finalists. We'll be making the decision, if not this week, certainly next week, and we'll go from there. And it's one position that's currently open. And what I should point out is that the meetings occur typically around noontime at Panhandle Health, approximately 9 to 10 per year. Sometimes there are other times scheduled as necessary depending on the situation. So before we start, tell us a little bit about, we have your resume before us, so tell us a little bit about yourself.
My name is Jessica Jameson. I'm an anesthesiologist by training, a former flight surgeon for the military. I've been living in Coeur d'Alene for about 10 years since I exited fellowship.
Excuse me, can you pull the mic in closer?
Yes. I can also talk really loud if you want me to. Here we go. Let's see. So I am an interventional pain physician. I did a fellowship after my anesthesia residency, and so I do full-time interventional pain. which I think, as we all know, is the opioid epidemic is upon us and a big, huge public health problem nationally, potentially globally, but certainly more nationally at this point. I am the founder and owner of my current practice, which is called Access Spine Center. And we're a comprehensive spine practice in Post Falls and Coeur d'Alene.
Okay. And you've been in practice for how long?
So I have been a pain physician for 8 years. I went back to residency after my military payback time.
Okay.
So I was a flight, as I said, I was a flight surgeon for them.
So you were Air Force?
Yes, sir.
Okay.
You're gonna hold that against me.
No, thank you for your service.
Yeah, absolutely.
The pleasure was all
Okay.
mine, that's for sure.
So we have a series of questions, and by all means, if you want to ask us a question in return as we proceed, feel free to do so. But Leslie will kick it off. Go right ahead, Leslie.
Sure. What is the role of Panhandle Health District's board?
So the role of the board is to assist with making decisions in the best interest of public health. The Panhandle Health, the public health sector is in charge of making this a healthy place for its citizens to live. And the board guides and directs a lot of those decisions that come as a result of that and to that end.
Okay. I guess I go next. Okay. Do you have any idea where their funding comes from?
Their funding comes from state and local funding. They get grants. There are fees associated with some of the services they provide. I believe that's it.
Would you have any idea how much we fund them?
I do
I'm not trying to put you on the spot, but,
I do not know that.
okay. Bill?
How do you feel recently, we've been quite through the ringer on the mask mandate. Do you think mask mandates are appropriate?
I have a hard time with mandates in general. I think that I feel pretty strongly that civil liberty is very important. And I think, especially in Coeur d'Alene, that's sort of the history of this area. A lot of people move here for that reason. Now, I think that this becomes a little bit of a gray area in some ways, particularly with something like the mask mandate. Sometimes with things like vaccines, it becomes a little bit of a gray area as well. And extremely challenging, as we've noticed in our community. There's a lot of emotion that goes behind a lot of this. So to get to the actual question that you asked me, I actually do not agree with a mask mandate, and that is not a popular opinion, I would say, in my profession. I think that there are a lot of studies that have come out, and they go a lot of different ways. And I think that that's part of what has gotten us into this situation as a country, is that there's a lot of differing studies that say very different things. And you can make a lot of studies say very different things. So being able to critically look at the science is a skill set that I think the vast majority of people likely lack. I mean, it takes a lot of time and effort to really be able to critically look at a study. Who's funding that study? What do they have to gain from putting this study out? And so all that to say that I think that protecting the health of my neighbor and my community is important. But I have concerns when we start to mandate things that potentially don't have the quality of evidence required to know that that is something that's going to be beneficial.
Okay.
Yeah,
Okay.
I'm fine.
Leslie?
Thank you.
What do you think about the one septic system per 5 acre minimum rule over the aquifer?
I have some concerns about that. I think that this is going to become so much more of a concern as more people move here. That the aquifer is something that we need to protect, certainly. So that five lots, I think it depends a little bit, but I do have concern that that's too many right over that aquifer.
Okay, so sorry.
No, I think
One, yeah, and I may not have stated
One
this right.
septic tank for 5 lots.
One septic system per 5 acres.
Acres.
Yes.
One home, basically one home
Yeah.
for 5 acres.
So I apologize,
One
yeah.
home for 5
Yeah,
acres.
not 5 on 1 acre.
Okay,
Yeah, one home per 5 acres.
I'd like to change my thought on that. One home per 5 acres. You know, I think as long as the science supports that, I think as long as we're doing these nutrient evaluations, as long as the science supports that is a safe and reasonable thing to do. We've been doing these evaluations on septic tanks and septic system requests for many, many years. And so if the science supports that, then I think I would absolutely agree with that.
Okay. I'm going to go back to the mask mandate for a moment. And I guess this is somewhat related. Your philosophy on vaccinations. Should they be mandated? Should they? And I realize when you go back to the Salk vaccine and the eradication of polio and whatnot, so there's a long history here. So answer that question as you see fit.
I do not think that vaccines that have not been fully tested, fully approved, and have a track record should be made mandatory. I think the polio vaccine, and again, this is where you get into a little bit of a gray area. We don't mandate the influenza vaccine. We know that influenza mutates. We now know that SARS virus mutates. And so I think mandating for diseases like that is a very slippery slope. Now, when you're talking about polio, which was a disease that most physicians these days have never even seen. We see some post-polio people, but we've never seen polio. And we were able to eradicate that disease. I think it has a long track record. That vaccine has a very long track record, has been proven to be safe and effective. And so in that instance, I think mandating vaccines like that is in the best interest of our of public health, as we've been doing for children going to school.
Okay, I'm going to ask you a quick follow-up. But it's not, when that vaccine was developed, I believe in the 50s? Mm-hmm. But at some point, a decision had to be made because the situation was presumably critical. And one could have argued even then that perhaps the vaccine was not fully tested, but the decision was made to mandate. I don't know if it was mandated right then and there, but go right ahead.
I think that it took quite some time before we started mandating any vaccines in the United States. My concern, so when you look at the morbidity and the mortality from polio, I think that is, it is obvious that disease killed many, many people and left many with neurologic defects. I have concern about, certainly there are people dying from the coronavirus. That I'm certainly not saying that this is not a public health emergency, a pandemic, something that we need to pay attention to. But the concern I have is that this is a vaccine that was granted emergency authorization.
Okay.
The FDA has a very specific set of criteria that they go by in order to fully approve anything, and we've relied on them for decades to do this. And there is still question about, does this mutate? Do we need booster vaccines? Do we need to have one every year? Some have said we may need one every 3 months. There are questions about, does it prevent me from spreading? That hasn't been definitively decided, and hence we now get vaccinated, but we must still wear masks and we must still social distance, and there's a lot of things that we have to do because of that. And so, it's my opinion that at this point, mandating the COVID-19 vaccine, or the influenza vaccine for that matter, is not appropriate.
Premature?
It's premature.
Okay.
I think that's a good way to state it.
One follow-up, is the polio vaccine mandated in the United States?
Polio is one of the vaccines that is required for children to get into kindergarten, or to go to school. That's one of the ones that needs to be proven.
Do you want to go?
Oh, sure.
It's your turn.
My turn.
I'm sorry, apologize. Go ahead.
What other areas does Panhandle Health work in besides mask mandating?
Thankfully, there's a lot of others. They do things like suicide prevention. We talked about the opioid epidemic. I've been fortunate to be on that task force to kind of look at what that looks like in our community and how can we prevent deaths from that. They do things like teen pregnancy. They do water, septic and water. They do vaccinations. They provide some basic health care. They do nutritional interventions for young children. What else? Water, soil, food establishments. Oh, gosh, there's a lot of others.
That's pretty good.
That's plenty.
It's a
I
lot of
feel
work.
like you got,
Go ahead, Leslie.
Do you believe nutrition/prevention should be a bigger role in Panhandle Health's community education?
Yes.
I think you answered the next one, so I'm not going to ask it. It was actually, can you imagine a circumstance when mandating a vaccine could be necessary? I think you answered that. How would you keep us, if you're the individual selected, how would you keep us, the Board of County Commissioners, apprised of happenings at Panhandle Health? I guess the question is, what's your preferred method of communication?
My preferred method of communication is email. I think following any of those meetings, if there are, mandates that may need to be acted on, then that certainly takes precedence. But just updates about what was discussed and what the trends are looking like and any concerns we may have moving forward. I think for the sake of your time, email may be the most efficient way to do that.
Okay. Go Bill.
okay, what areas do you feel that stem cell therapy is useful for and a proven treatment?
So stem cell therapy has been used in cancer for many years. I think there's evidence there. I think we are getting more and more evidence on stem cell therapy. Now, the problem we run into is that there are multiple types of stem cells. Most of the data is on autologous stem cells coming from your own hip or your own bone marrow. And there is actually decent data for that in joints for people who are trying to avoid joint replacement. There's decent data for that. We will continue to get more data in spine as it comes to this, regenerating tissues. One of the big problems I see, not just here but nationally, is that the FDA kind of doesn't regulate a lot of this. And so even locally, we have IV stem cells being used to treat people with Parkinson's or multiple sclerosis, which is, in my opinion, just preying on people.
I was going to say, extremely questionable.
I think it's the most unethical thing.
Good,
It's completely
okay.
unethical. And I think that, 80% of those IV stem cells sit in your lung and get eliminated, and yet you're
That's
paying
what I wanted to know.
$10,000 for one treatment.
Or more.
Or more, right.
Yeah.
And then it's not ever just one. And so there is zero evidence for that, and in fact, there's evidence of harm being done to patients through that.
Thank you.
Go right ahead, Leslie.
Think I'm done. I think I'm good.
Questions for us?
I would love to hear, outside of COVID-19, what your thoughts are as this area is growing. What's the biggest public health hurdle that you see ahead of us in the next 10 years with the explosive growth of this area?
I think water is going to be a big one, water quality. I lived in areas where people didn't know better, and they had their septic tank and their well on the same side of the house. And I said, that's just not a good idea. And they said, that's the way my grandpa did it. It's my right, leave me alone. And I think there's going to be more of that here before it's settled.
I think it's nutrition, just getting the education out there, take care of your bodies, take care of your health, and, let food be your medicine rather than medicine be your medicine.
The majority of our transplants, and this might have changed because of COVID, because COVID's been an accelerant for people moving in, but the majority of our transplants are over the age of 60. So I think that's going to present some unique healthcare situations. If we are confronted, God forbid, with another pandemic, that's going to be, as they age, the presumably more susceptible population. So I think that's going to present challenges. I think water is going to be an issue nationally, but I think we're a little more blessed here in the Pacific Northwest, and especially with the aquifer. But I would say the aging population. As I said, COVID is changing it a little bit because those who can live and work remotely and are still employed, obviously, are a younger generation. But I think it's going to be the age. Got more questions for us? No, sir. I think that's it. Sure. By the way, do you prefer to be, do you prefer to be dressed as Jessica or Dr. Jameson? Okay.
The doctor has worked long and hard to be a doctor too, so.
You know, when I look at the education, I think, okay, we need to give some consideration here.
Well, thank you for throwing your hat in the
Appreciate it.
ring. Thank you for being willing to serve.
Thank you very much.
Appreciate it. Thank you. We should be making a decision, if not later this week, certainly next. Thanks a lot. Okay.
Public comment?
Public comment, come forward. Just give us your name.
My name is Suzanne Knutson, and I am just wondering how many of the interviews that you're holding, out of the 17 or 18 resumes that you received, how many are in the healthcare industry, and how many are in other areas of industry? You've mentioned that the aquifer and water quality is going to be a big thing, and also nutrition. And I'm just wondering, what other areas of people are you interviewing besides healthcare? Other than doctors and nurses?
So out of the 6, we have 5 in the medical field, and one of them actually is more in the nutritional field and a little bit with environment as well. So he's like nutrition/environment.
Why are you not interviewing more people who have experience in environmental areas, like water quality, like water quality?
Right.
That's a good question.
I'm asking because my husband applied. He sent in his resume, and he has a ton of experience. And I just wanted to hear what you were interested in finding. And I think that because of the Panhandle Health mask mandate and because of COVID, I think that you have a little bit of tunnel vision that you're seeing. And I know the scope of Panhandle Health, and I think that you might need advising on a bigger scope than you are seeking. And so as a citizen in Coeur d'Alene, that is a concern of mine. And that was why my husband sent his resume in, because he's concerned about it too. And he doesn't have a medical degree, but he has several degrees. And I just wanted to see what you were interested in. And people have asked me.
Sure.
And
So
so-
I will tell you that I had 2 more people that I wanted to interview who were not in the medical field.
Yeah, okay.
And
I
we
think
just
you're
had
right,
to-
but given recent history, a lot of it's been tunneled
And
into.
the reason I ask also is because in the whole district, I mean, we're number 1, right? The
District
other
first,
people
yeah.
on the board have medical backgrounds also.
Actually,
in the
just
other-
1. I think just one other one out of the 7 have any type
Are
of.
nursing and doctors?
So
there's only-
the 2 that represent
Are
Kootenai
we're
are
health.
medical,
Yeah.
correct? And then only one other one has any type of connection with
Okay.
a medical background. Everybody else is not medically
Non-medical.
And the
related.
others, I think, are, well, a few of them are elected commissioners. One is not,
Okay.
used to be.
Okay.
But I'll read you just an excerpt from the code,
Yeah.
what the code says. It talks about what the actual election process. It says, "One member of the district board, if available to serve, shall be a physician licensed by the Idaho State Board of Medicine, and no more than 1 member shall be appointed from professional or special interest. All members shall be chosen with due regard to their knowledge and interest in public health and in promoting the health of the citizens of the state and the public health district. Representatives shall come from both rural and urban populations." We actually do have people on the board. I think Eric Kettner has some involvement or some background in water quality. I think your point is well taken. I don't know that I can give you a good answer for that.
It's okay. I'm just giving you my opinion.
No, that's perfectly, and it's perfectly valid. We do have people currently, not on the board, excuse me, but we have people employed that have an understanding of water quality. So I don't think it's a problem from that perspective, but I don't know that I can give you a good answer. I think for me, it was the interest in, not just the interest in public health, but some involvement with that.
Okay.
And, yeah, it could have been the influence of COVID as
Yeah.
well. Now, had we had a second opening, I think we would have had a different situation.
Right, I think so too.
Yeah,
Yeah. All right.
but your point's well taken.
Well, thank you. Thanks for listening. And thanks for being willing to toss it out there. And the other thing I wanted to commend you on was that you did a pretty good job of putting the call out to people. I saw it on several different forums, and that is not always the case in Coeur d'Alene. And so I just wanted to commend the commissioners for doing that because it was impressive, and people wanted to spread the word. So
Good, thank you.
thank you. Thanks for trusting your citizens to come up with somebody who is qualified to do this position. So
And thank you for your engagement.
Yeah, you
thank
bet.
And your questions were great.
Thank you.
I'm a former teacher, and I still get former students that ask me to do a mock interview with them, and I wrote down all of your questions because they're fantastic. So
Well, thank you.
yeah, so thank you.
You bet. And this is the lady that handles the promotion and the public dissemination, so kudos to Nancy. Thank you, Susan. We appreciate it. Anyone else? Anyone on? Oh, 6, okay. I'll ask again, any more public comment? Hearing none, 3:53, and this meeting is adjourned. Thank you.